Hi everyone. It's good to be here. It's always a little bit of a disconcerting when I'm talking and I don't have any reaction, and also I don't have any figures in front of me to show you. So I'll try to do less gesticulating and try and be a little clearer. So I've been asked to talk about anxiety disorders. Look, anxiety is a part of almost every psychological problem, but it also can be a problem of anxiety itself. So let's start by one thing. The reality is that anxiety is something you absolutely need in order to survive. It's an alarm that the body that rings whenever we're threatened by something, and it's normal and it's necessary to be scared. If I'm driving, if I don't have any anxiety, I'm not going to slow down when it gets slippery and so on. Let me give you a few images that I think will help to illustrate. First and foremost, let's imagine that you're running on a treadmill or you're exercising or something else. What happens to your body? Your body responds, your heart rate increases, and you can have a very strong physical response even though it's completely normal. In other words, there's nothing wrong with your body reacting, and as soon as you stop exercising, your body calms down. And you don't have to do anything for it to calm down. It calms down on its own. So it's important to understand that first and foremost, your body is going to react strongly when it's challenged physically, and it's going to calm down on its own when you stop challenging it physically. Now, think about anxiety. If you hear someone in the basement open the basement window and crawl in through the basement window when you're at home and it's 3 o'clock in the morning, you're going to freak out. It's a completely normal response to freak out. In other words, your body is going to react. You're going to have a strong physical reaction, and you're not going to question your body. You're going to question whether there's a burglar in the house. Now, let's suppose that you see your little brother come up the stairs and say, "Oh, I thought everyone was asleep. I forgot my keys. I came in through the basement window." Oof, okay, so now you realize that it wasn't a burglar, it was just your little brother, so you calm down, and of course your body takes a little while, but it will calm down on its own. In other words, when you're scared, your body reacts just like when you're exercising. It is challenged, your alarm rings, and your body reacts strongly. As soon as the threat is gone, your body calms down on its own. In other words, anxiety is a response to a threat, and it makes your body react, and as soon as the threat is gone, your body calms down. Okay? So now let me give you a couple of other examples. Let's suppose that you are walking in the woods, and you're out camping, you're looking for some food to eat, some berries, whatever, and off in the distance you see some leaves moving. And now, as you're looking, you see in between the leaves the snout of a bear sniffing around. What happens? Immediately your alarm goes off, you start freaking out. Hopefully the bear doesn't see you. He's off in the distance, and very slowly, quietly you back away. You're terrified. You're watching the bear. You're backing out until you get back to safety, and then you calm down. In other words, again, a real threat, you feel anxiety, you react, you run away, you protect yourself, and you calm down. And you'll notice that it is absolutely necessary to have that response. It's kind of like the psychological equivalent of pain. If you go outside in winter and it's minus 30 and you don't have gloves on, your body detects that there's something wrong here. You feel pain, and it says to you, do something, you got to warm me up. And so you protect your hands, you cover them, you blow on them, and you find some heat and you find some shelter, and you will do so until you've calmed down. So anxiety is a similar thing. It is there to protect you. We evolved in a natural world. We evolved in a world where there are predators. We can be eaten, and so we have to learn to defend ourselves. And we've evolved what's called the fight or flight response. So normally when we're the face of a predator, we try and run away, and if we're trapped, we'll turn around and defend ourselves. And it's not a human thing. All animals do that. I mean, if you get a squirrel caught in your kitchen, the squirrel is going to run away, and if you kind of go after it, it's going to turn around and attack you. And you even see this in flies, for God's sake. You know, a fly in the corner of a room, corner of a window, as soon as you go towards it, if you put your hand near the fly, it's going to buzz around like crazy. So we have this mechanism that says protect yourself. So anxiety is good, okay? And let me give you a couple of examples. Driving and health. If a person has no anxiety driving, like I said before, when it's snowing or when it's raining hard or whatever, why would they slow down? So a person without anxiety really puts him or herself at risk and other people as well. Let's take health. A person who doesn't worry about their health, why should you bother exercising? You know, you don't worry about smoking, you don't worry about what you eat, and so on and so forth. So a person without enough health anxiety isn't necessarily doing the right thing and is putting themselves more at risk. So not enough anxiety is bad. You give both these people a certain amount of anxiety, and the guy will slow down when it snows. The guy will make sure he's got good tires, and his tires are inflated, and if his brakes are making noise, he'll address that. In other words, a little bit of anxiety is necessary to keep him safe. With respect to health, the guy who worries about his health will not smoke, will watch what he eats, will go see the doctor, and so on and so forth. However, take these two gentlemen and you add anxiety and you keep going, take it to the extreme, and the person who's so scared of an accident when driving ends up staying home and doesn't function at all. Or the person who's so scared of illness ends up being a hypochondriac and seeing a doctor every week until eventually doctors don't pay attention to him anymore. So too little anxiety is dangerous. A little bit of anxiety protects us, although it restricts us a little bit. You know, we can't eat what we want, we can't do whatever we feel like, we can't drive as fast as we want, but a little bit of anxiety protects us. It restricts us, but it's a fair exchange. Now, too much anxiety, and all we feel is restriction without necessarily feeling any safer. So anxiety isn't good or bad, it's about the degree. Now, I'll give you another little image to keep in mind. Let's suppose that someone throws in, you're walking along and all of a sudden you see a hand grenade land in front of you. Now, hopefully that doesn't happen too often, but if there's a hand grenade in front of you, you're going to freak out and you're going to run away. Your heart's going to pound. You're going to sweat. You're going to have this very powerful reaction, but it's going to be a normal reaction in response to the grenade. Let's suppose instead of a grenade or instead of a bear or something of that nature, you feel something in your chest. A little palpitation, a flutter, a twitch, whatever it is, an arrhythmia, which is benign, but you feel something in your chest, and now you get the thought, what the hell was that? Do I have a heart problem? Well, what is a normal reaction to the belief that you're having a heart attack? I mean, it's normal when you see a grenade to freak out. Wouldn't it be also normal to freak out if you think you have a heart attack? And the crazy thing is, if you think you're having a heart attack, your heart's going to pound because you're anxious. You're going to have a powerful reaction. Again, a normal reaction. Just like the treadmill, just like the bear, just like the burglar in the basement, the body responds normally to any kind of challenge. It's a powerful reaction, but it's a normal reaction. So here you are freaking out thinking you have a heart attack. You're taken, you drive yourself to emergency, you're taken by an ambulance to emergency, whatever, they hook you up, they got EEG and everything, ECG and all this stuff, and you're freaking out, and then finally the doctors come to you and say, okay, turns out that there's nothing wrong with your heart, it's just panic, okay? Well, if you don't believe them, you're going to say, why don't they believe me? And then you've got a heart problem and the doctors don't even take you seriously. But if you believe them and you say, oof, all right, it was just panic. So you're reassured a little bit. However, you just went through hell. You just went through a moment where you thought you were dying. You thought you were having a heart attack. You're freaking out. You go through this trauma at emergency. Well, isn't it normal to say, holy cow, I don't want to do that again? Now, let's go back to the example of the bear, okay? You're in the woods, you see the leaves move, you freak out, you go back, you protect yourself. What happens the next day when you go back into the forest? The next day, you're going to be looking left, right, behind you, in front of you. You're going to be looking everywhere. You're going to be what we call hyper-vigilant. You're going to be watching everything. And now imagine that you see some leaves moving off in the distance. Immediately you're going to freak out, thinking it's another bear, even if this time it's just the wind making the leaves move. In other words, when you've had a bad experience, you learn to be a little more careful. Every time you feel anxiety, you get more aware of the danger. You're driving, you lose control, you regain control. Woof. You learn next time you got to be more careful. You didn't appreciate the danger enough. So now you're watching the forest and you're reacting to everything, even the wind blowing the leaves. Well, if instead of the bear, you just went through this panic and you went through this hell and you don't want to go through hell again, well, what happens the next day? The next day, you're watching your body. The next day, you're checking everything. You're focused, super focused on your body. And anything that happens, a little twitch, a little bit of anxiety because you just went through hell the day before, all of a sudden, as soon as your body feels anything, here it's coming again. Oh, my God. And boom, you have an immediate panic attack. So the thing about a panic disorder or any anxiety problem, usually, at least for many people, anxiety is a fear of anxiety itself. And so it's an alarm. It's an alarm that rings in the face of threat. If you're afraid of being anxious, then as soon as you get some anxiety, you get anxiety, which then confirms that there's something to be afraid of. And that's the vicious circle of a panic attack. Okay? I'm going to jump around a little bit. I'm trying to squeeze, all this into 25 minutes or so. But let me simplify anxiety, because ultimately an anxious person isn't necessarily any different than a normal person. We all need anxiety and so on. But an anxious person has a hard time separating a thought and reality. Like, for example, if I think, I hope my children are safe, I wouldn't want to lose a child. Well, no one wants to lose a child. And if it happened to me, a psychologist, it wouldn't be any easier than if it happened to someone else. But I can say the words, and I don't have to do anything. I don't have to call my kids to make sure they're safe, because it's just a thought. And I can separate thought from anxiety, from reality, rather. So anxious people have a hard time doing that. So ultimately, if you want to simplify anxiety, the best way to understand it is it's a fear that something bad is going to happen. It's as simple as that. And of course, it's not bad to have some fear, but ultimately it's an alarm that rings in the face of threat. It's a human, in fact, it's an animal emotion. It's an alarm that rings in the face of threat. So what threatens us? What are the threats that we face in life? There are three main threats. One is a threat to the body. So people are afraid of dying, let's say. Anyone afraid of a heart attack in an elevator when they're trapped? Anyone afraid of, plane crashes or buildings collapsing on them and so on and so forth, afraid of terrorist attacks? These are all people ultimately who are afraid of dying. So it's an alarm that is particularly attuned to survival, physical threat. And so a lot of people suffer with fear of that, fear of dying, those kinds of things. Another main threat to human beings is a little more subtle one. It's a threat to the mind. It's a fear of going crazy. It's a fear of I'm going to end up in a loony bin, quote unquote. I'm going to do something against my will. I'm going to harm my baby by accident or on purpose. I'm going to lose control and do something crazy. And as crazy as it might sound, we could be on the edge of a metro platform or 10 feet away from a metro platform. We're not really in any danger, but oftentimes we feel that we're almost being drawn to the edge, and so we lean the other way. That's anxiety saying protect yourself. It's the fear of physical danger, the fear of heights, which is a normal thing that pushes us away. But sometimes we almost feel as if like we have this urge to run off the edge. And I don't know if any of you get that, but I'm sure many of you do. Or sometimes you have a knife and you almost are afraid that you're going to cut yourself or someone else. These freak people out, but the reality is these are completely normal things. This is anxiety saying be careful. This is not anxiety saying do it. This is anxiety giving you the impression that you're going to do it, which is a fear of doing something. It's not the desire. In fact, it's the opposite of actually wanting to do something. So a lot of people are afraid of losing control of their minds. That's another main threat. And the third threat that human beings have is a threat to the image. Looking stupid, saying something stupid, looking crazy, turning red, sweating, shaking in front of people when you're signing a check, whatever, those kinds of things. So if you think about it, essentially people are afraid of dying, of going crazy, or looking crazy. It simplifies it all. And many people have a combination of those things. Take something like the fear of flying. Okay, people might be afraid of flying. One person in a group might say, "Well, I'm terrified of a crash," and another one says, "I'm not scared of that at all. I know planes are safe. What scares me is that I'm going to suffocate because I'm going to freak out. I'm going to have a heart attack." So that they're both afraid of dying, but one's afraid of dying from the plane crash. The other one's afraid of dying from the panic. Okay. Another might say, well, I'm not worried about the plane crash or that. I'm just worried about I'm going to lose it. I'm going to be under so much pressure I'm going to lose it. I'm going to go crazy. Okay? That person's afraid of going nuts. And another one says, well, I'm not afraid of that. I'm not afraid of the plane crash, but I'm afraid of panicking and embarrassing myself in front of others. I'm going to throw up and people are going to laugh at me, or I'm going to be freaking out and people are going to laugh at me, and so on and so forth. In other words, even though they're all afraid of the airplane, they're really afraid of different things. So to simplify anxiety, I say to people, what are you afraid of, and what do you do to manage it? What do you do to control it? Because ultimately, when you're under threat, when you're anxious, you want control. So if you go into a forest and you're afraid of bears, well, you bring a rifle and you feel in control. If you're afraid of getting lost, you bring a compass. If you're afraid of running out of food, you bring food. So control is the antidote to anxiety. And it's necessary, it's necessary to be anxious because it makes us think about all the things that can happen, and therefore we retake control. And the problem with anxiety is that we can't control completely. So anxiety disorders can be described as a fear of losing control over a threat, essentially. And the threat could vary from one person to another, but as I said, in general, people are either afraid of something physical happening, or they're afraid of their mind or going crazy, or they're afraid of looking stupid. That pretty well covers everything. Okay. Now, people are probably going to be curious to know where it comes from. So let me ask you to imagine a few scenarios here. Imagine that you're in a room and I'm standing next to you and I pull a big snake out of a bag and I let it crawl around in between your legs. There's a pretty good chance that at least half of you say, I wouldn't want that at all. Okay, never mind that. I'll give you another example. Let's suppose that instead of a snake, I got a tarantula in a little box, and I'll take it out of the box, and we're going to take turns putting the tarantula on our shoulder for 30 seconds each. How many of you would be uncomfortable? And many of you say, oh my God, I wouldn't want to do that. Okay? Okay, let's suppose now instead of a snake or a tarantula, I ask you to put on some oven mitts and take a cake out of the oven. How many would be uncomfortable with that? And I dare say none of you would. Now, I want you to think about your histories. How many times have you been bit by a snake, by a venomous snake in your lives? How many times have you been bit by a venomous spider in your lives? And probably none of you have. How many times have you been burnt on a stove or in an oven? And almost all of you have. So what that illustrates is that human beings have evolved certain instincts to be afraid of certain things that make sense in a natural world. It makes sense to be afraid of heights because there's no such thing as a safe height in the natural world. It makes sense to be afraid of snakes and spiders because they can kill us. It makes sense to be worried about being away from security. It makes sense to be afraid of being trapped, of being in a cave. If you're alone in a cave or in a tunnel underground, a predator can find you and you're dead. There's no fire escape in the natural world. But now, we are no longer in a natural world. We're in Montreal or wherever you are in 2017. And now, instead of a cave, you find yourself in an elevator. Or you find yourself in an MRI machine or something of that nature. And all of a sudden, you have this feeling like you're being trapped and you want to get the hell out. So the reality is that we have instincts to be afraid of certain things more than others. And in our world, it takes on a different dimension. All of a sudden, we're worried about traffic on the bridge. We can't get out. We're worried about the metro. Can't get out. This kind of stuff. It's not as if we are in danger because there are fire escapes and so on and so forth. But our instincts are telling us that we're trapped. So we have certain fears that are more likely to develop than others. So a big part of anxiety comes from who we are, comes from our evolutionary learning. Now, another part of anxiety, however, is individual. And I'll ask yourself a simple question. If you have more than one child, are they the same? And usually people say, not at all. And if you don't have children, your siblings, are they the same? And you'll notice that people are very, very different in many ways, despite the fact that we're pretty well born with more or less the same genetic makeup. And that just goes to show that you see right away that some children are always happy, some seem to be frustrated all the time, some are able to let go, some are not. And some tend to worry more than others. And so part of it also is your individual temperament. And a third component is your experiences. If you're raised in a family that puts a lot of emphasis on health and worries a lot about health and what you eat and so on and so forth, you're more likely to develop health anxiety. If you're in a family that focuses a lot on appearance and how you look and what people think, you're more likely to be worried about social anxiety and looking good and so on and so forth. So events, attitude, upbringing, that also is a final contributor. So we are anxious because we have to be anxious as human beings of certain things, or some of it is instinctive. Some of it is our own individual makeup, and some of it is affected by events and by upbringing, by learning. I'll give you a couple of examples of that. There was an overpass, the Concord overpass a few years ago that collapsed. Well, how many of us drove the next week looking at every overpass that we went under? All of a sudden, the event sensitized us to a fear. But it also works the other way. When you're a kid, you're in an elevator the first time, you're going to be uncomfortable. But a little kid holds mommy's hand or daddy's hand, and in holding mommy's hand, I guess you learn that, okay, I suppose I'm safe, I'm protected. And so over time, you take the elevator and you learn it's not scary, and you overcome this instinct. So we have a combination of instincts, we have a combination of individual temperaments, and we have a combination of experiences, all of which produce anxiety. But what's important is this mechanism that makes it better or worse. When we are scared, let's say you see the bear in the woods, or you lose control of your car, or something of that nature, it is absolutely normal to be anxious, and it teaches us to be more anxious next time. In other words, be more careful next time. And you should listen to your anxiety. I mean, it is, if you are worried about your health, you should pay attention to it. If you're worried about your car, you should pay attention to it. But when anxiety is exaggerated, then should you listen to your emotion? If you're walking in the woods with your psychologist and you run into a bear, should you run away? Should you go towards the bear because psychologists tell you to always face your fears? Or should you run faster than your psychologist? So, of course, you should run faster than your psychologist. But the reality is that normally we listen to emotions, but when they're exaggerated, you're in front of an elevator, your emotion is telling you to take the stairs. If you do that, you're going to be more afraid the next time. So every time we listen to fear, or every time we feel fear and we respond to it, it confirms the fear. And it does it for real fears, but it's the same. It works the same for imagined fears. So what you need to do when you have an imagined fear is the opposite of what's natural. You need to stay in the elevator and prove to yourself there's nothing to be scared of. It's a simple statement. It's a little more complicated than that. But the reality is that ultimately, if you face your fears and you don't run away and you stay until the anxiety starts to drop, you will have less anxiety the next time. So look, it's already 7:30, and I've given you a lot about where it comes from and so on. If you can indulge me an extra 5 minutes to sort of talk a little bit about what needs to change. Human beings act, human beings think, human beings feel. That makes up the human experience. If I'm afraid of an elevator, I'm going to feel anxiety and my heart's going to race, this kind of stuff. I'm going to have all kinds of negative thoughts. I'm going to be terrified of being trapped and so on. And I'm going to act accordingly. I'll take the stairs, end of story. So what we need to do is we need to change three things. First and foremost, we need to stop running away from imagined fears. We need to run away from real dangers. We need to prove to ourselves there are no real dangers when it's an exaggerated fear. And when a fear, something you don't like, makes you suffer tremendously, when you don't function normally, when you drop out of school because you have to give presentations, when you refuse a promotion because it involves air travel, then anxiety controls your life. Then you need to not listen to anxiety. And so what you need to do is you need to gradually face your fears. Get on that elevator, take the car, get on the bridge. Now, of course, if you do it and you freak out and then you turn around and go home, all you've learned is that it was hell. So you need to be able to stay in the situation until the anxiety starts to go down. So a simple principle is that if you leave a circumstance when anxiety is going up, it's going to be worse the next time. If you stay until it starts to go down, it'll be better the next time. And so you don't have to torture yourself. You can do it in steps. If you're afraid of an elevator, you do one floor at a time. You go with someone. If you're afraid of driving on the highway, well, maybe you can go on a Sunday morning when there's a few people. Maybe you can stay on the service road, get on one exit, and get back off immediately. In other words, first thing you need to do is you need to stop acting on irrational fears. You need to change what you do. You need to stay rather than run away, and you need to stay ideally until you've calmed down before you leave. That's the behavior. At a level of thoughts, it's important also to recognize that a thought is not reality. If I ask you to choose between cancer and fear of cancer, what would you rather have? Now, most people from the outside say, well, I'd rather have the fear because they recognize that it's not real. But if you actually believe you have it, oftentimes people who believe they have it will suffer more than people who have it because, I mean, not to say that it's one illness, in some cases it's horrible, but many people are treated and so on and so forth, whereas imagination runs wild. The person who thinks they have something can only picture the worst case scenario. So the truth is that just because you think something is dangerous doesn't mean it is. I had a lady who was convinced that she was going to have a heart attack in the metro from the stress. Yet when she took her pulse was never more than 75. When she came to my office, I had her run up and down the stairs a few times. Her heart rate went to 100 and she didn't worry at all. The point is that she believed that her heart was vulnerable, and it was a belief that fed her fear. So ultimately she had to learn that, look, just because it's uncomfortable doesn't mean it's dangerous. So the second thing you need to do is you need to reevaluate your perception of danger. Most of these things are uncomfortable, but your body can respond. If you're running, if you're exercising, your heart could really go fast, and it's never a worry. So just because your heart reacts, or just because your mind goes places, just because you have a thought, doesn't mean you're going to act on that thought. I had this one gentleman who read about an article I wrote on intrusive thoughts, and he called me from France, and he calls me like every 5 minutes to check something else. And he's a 23-year-old man, and he said, I saw a girl, I think she was only 17 or so, maybe 16, 17, somewhere there, and I found her attractive. Does that make me a pedophile? And I said, well, I got news for you. When you're 70, you're going to find a 17-year-old girl attractive. But more importantly, I said, it doesn't matter, because if I told, then he called me back to say, what about 14? And I said, it doesn't matter, because if I told you that's normal, but 2 years old isn't normal, you're going to start imagining 2-year-olds and questioning whether you have an attraction. In other words, you're afraid of something. You're not the thing. Being afraid of becoming a pedophile is not the same as a pedophile. Fear of cancer is not the same as cancer. Fear of going crazy is not the same as being crazy. Fear of a heart attack is not a heart attack. It's a fear. And so the second thing that needs to change is your belief system. And then the last thing that needs to change also is your perception that you're losing control. I mean, the fact is that if you can't control your mind, you think it's going to take over. You feel as if you can't control your heart, it's going to take over. Well, the reality is you don't need to control it because it controls itself, because there is no danger. So not having control doesn't matter if you don't need to control something. So just like when you exercise, your heart will control itself. And your thoughts will go wherever you want. Whatever you're afraid of, your mind will go there. That doesn't mean you're going to do those things. You cannot act against your will. So ultimately, it remains a fear of something. Okay, so last thing. What do you do? Well, look, I mean, the fact is that anxiety is relatively normal. It's also relatively easy to treat. For people who, there's a lot of information available. I have something on anxiety management that we're going to put a link to if you're interested in. By the way, I don't write for Metro anymore. I now write in Huffington Post, but my blog is still active, at least for a little while now. We'll see. That might change with all the mergers in the healthcare system. But in there, I have a lengthy article on anxiety management. And there's also, in categories, you can click on anxiety and read all you want, different stories and so on about anxiety and so on. So people often ask about treatment. Generally, there are a lot of good treatments for relatively mild to moderate anxiety. Usually, psychological treatment is fine. In fact, it works for a lot of anxiety. Occasionally, when that isn't enough, when a person reaches a plateau, we can add antidepressant medication, which is very useful for anxiety. In fact, it's probably better for anxiety than depression. And for more severe cases, usually we recommend a combination. But those are effective treatments. I think ultimately you don't need to control your body. And it's not about saying, I got to breathe a certain way, I got to make sure I don't have caffeine and so on and so forth. You need to learn that there's nothing that needs to be controlled because there's no danger. Sometimes when people feel they're short of breath, they take deep breaths, or they try and calm down by taking deep breaths. The only thing that's going to happen is you're going to hyperventilate. And then you're actually going to start feeling lightheaded. You're going to feel like you're losing your mind, so it only makes it worse. Your body will get the air it needs. You got to trust your body. You got to trust your mind. And that's the best way to manage anxiety. Okay, so we'll stop there, and I guess we'll open it up to questions.
Okay, I'll get it started. Dr. Zacchia, in terms of how common they are anxiety disorders one of the more common forms of mental illness?
Yeah, when we talk about 1 person out of 5 at some point in their lives will suffer from, have a diagnosis of a mental illness, the reality is that that number is a little bit loose. I mean, there are serious illnesses like schizophrenia, like bipolar disorder, and so on that affect a small percentage, maybe 1% of the population. And then there are things like depression that we all are going to feel from time to time, reacting to events, breakup, loss of a job, health problems, and so on. At what point would you call it an illness? Anxiety is also very common. And if we really stretch the definition and we say, well, okay, are you afraid of bees? Are you afraid of flying? And many people just avoid those things, and they live perfectly normal lives, so they look like they haven't suffered. But if they would, let's say their family lives far away and there's a funeral to go to and they're terrified, all of a sudden they're freaking out. So at some point, we all have anxiety, so it's much more common than we're led to believe. But we generally estimate that about 10% have significant anxiety issues in their lives. I'd say I'd go as high as 25% have enough anxiety that it causes them distress. And I'd say, the rest of us have, anxiety from time to time, and we don't worry about it too much. But, give a person a diagnosis, a medical condition where the doctor says, I don't like the sound of that, I'm going to order some further tests. Anyway, it'll take about a week to get the results. Try to relax. Try not to freak out too much. I wouldn't worry about it if I were you. Well, good luck with that. Okay. The fact is that it's pretty normal. But yeah, there's a significant percentage of people for whom it really does control their lives.
Can you hear me?
Yes.
Okay, great. Okay, I'm just wondering because my son suffers from eczema, and
from what? Sorry.
My son has eczema.
Okay.
And eczema, as you might know, can lead to anxiety and depression. And so he did have a very, very difficult episode after going through a program at university that was very stressful, and the eczema was quite bad because of the anxiety, of the difficulty of the situation, and so on, and it led to insomnia, and then he ended up with depression. And so he went through a couple of years of difficulty, and he's feeling much better now, but he's not able to think about, right now, he finished his university program, and we would like him to think about looking for work or think about what he'd like to do. It's a difficult situation because I don't know if he's going to want to continue in that field, but he has to think about it, and he, like I say, went through quite a long, difficult period. So he really feels like he's had PTSD, that's what he mentioned. And so, at this point, it's been about, let's say, 6 weeks that that he's feeling much better, that he's feeling better, and he's socializing. He was even not socializing for a while, for a number of months, 4 months at least, and he's a very social person. So, so I'm just wondering what the best approach to take is, in this kind of situation, to let him, deal with it in terms of, just listening to himself, or like you said, to sort of not let it take over.
Yeah. Well,
not let it take over, and then just to sort of push ahead. So because you don't want it to this situation to last too long.
Okay.
You become afraid of continuing on and getting into the normal swing of things.
All right. Well, look, I mean, it's a little bit complicated. I don't know your son. There's a number of aspects to your question, but it's interesting because oftentimes we say that eczema or many other things, a doctor will say, well, it's stress-related. My general answer is that when a doctor says it's caused by stress, is the same as saying, I don't know what it is. Get out of my office. I mean, I'm exaggerating a little bit. It is, many conditions are worsened by stress. Okay, it doesn't mean that stress causes it, but it does tend to make people feel responsible. It's because of you. If you handled stress better, you wouldn't have a skin problem.
Right.
So that's kind of unfair, and then a person starts to say, well, what do I need to do? And then they feel like they're losing control and so on.
Yeah.
So first and foremost, look, it's a dermatological condition. Certainly if you manage stress, then it might get better. I think you should manage stress anyway, but stress isn't something you should stress over. If you worry about being stressed, then you're adding to your stress. So what you need to do is you need to take a bit of a longer perspective and say, do I have too much on my plate? Is it because I say yes to everything? Do I expect too much? So long term, you need to deal with stressors, but a short-term stress isn't going to kill anyone. Okay?
Right.
The problem is that when we have a condition, something that when we scratch all the time, it makes us crazy, and then we feel as if there's nothing we can do, and it just becomes overwhelming. And some people are able to tolerate their physical challenges, and other people, they can't let go. People who tend to be less able to let go and accept are people who struggle more with anxiety, struggle more with anger and depression and so on, because ultimately it's about tolerating lack of control or lack of absolute control. It's about tolerating doubt, tolerating uncertainty.
Yeah.
And then on top of that, you also have all the secondary stuff, like then you get kind of beaten up over the condition, and some people obsess over their bodies, obsess over their imperfections, and others are more able to let go. So I mean, I don't know what the best solution for your son would be, but certainly he needs to learn to accept things, learn to tolerate things. In fact, all anxious people, we get anxiety. It teaches us to control the dangers, but there are a lot of things we can't control. So part of the challenge is not just controlling what you can, but learning to tolerate the stuff you can't control. So anxious people have to be able to live with uncertainty. In fact, when we talk about generalized anxiety, we can rename generalized anxiety as an allergy to uncertainty. If you thought about that, then a person who worries that something bad is going to happen, there's possibility of bad things happening everywhere, anywhere, anytime. And so when you drive, when you face life, when you eat, anything can happen any day. But those things are rare, so you need to be able to do normal things despite that. What your son needs to do is he needs to face life. And he needs to, let his anxiety be and his worry be and not always try to address it. So he is probably obsessing over that, and that might be part of his makeup. And, there are a number of ways of dealing with it psychologically. There's medication also helps, and some people do meditation or other acceptance-based things. All of it is targeting learning to let go and not trying to fix every little thing. Sometimes it is what it is, and you have to be able to accept it. And by the way, accepting something does not mean liking something. It just means it is what it is. I don't like it, but set it aside and focus on your life, and that's what he needs to do.
Yeah. Thank you very, very, very much.
My pleasure.
Okay, we can
Hi.
take more questions. Oh, go ahead.
My name is Simon.
Hello.
And I'm also bipolar. And when I start to get sick, when I start to feel depressed or manic, it feels like my anxiety really, really increases. And I've always wondered if it's a different type of anxiety, or it's just anxiety is anxiety, or is is there something particular with bipolar and anxiety?
All right. Well, good question, because I'd probably say both. The fact is that any time a person has a physical illness, they say, I don't know, is it in my head? Is it anxiety? Is it real? I say, I'll tell you what, there's always going to be anxiety. Any physical illness is going to make you worried. So if I am facing an episode of a bipolar illness, I'm going to be really, really down. I'm going to be down about it. I'm going to be worried about it, and so on. And that is normal. So some conditions are pure anxiety, but there's always some anxiety that's going to be added to anything. So I think when you're facing something like that, I personally think it would be completely normal to be anxious about it. Okay.
Mm.
And there's not much you can do other than, learn to accept, look, it's an episode, there's medication, I'll have to go through it, and hopefully it won't be so bad, and so on and so forth, right? But nevertheless, it's hard to convince yourself when you're caught in it. But with respect to bipolar disorder, the reality is it's a mood disorder, right? And any time your mood is affected, your thinking changes. If I were to give a perfectly calm person a pill to treat, let's say, an infection or something, but the pill makes them anxious, or I give person a thyroid problem, and all of a sudden they start feeling anxiety, it is a physical thing, but they feel anxiety as a result of that. So when a person is bipolar disorder is probably the most physical of mental conditions, because it's not about your life. It's not about events. A lot of people would understand depression if you lost a loved one, if you lost your job, if you're bankrupt, all these kinds of things. But, when a person is bipolar, they get hit sometimes by these waves of emotion that don't seem to be related to events. And so especially when you're high, you start to get high, you feel a strong agitation, and the agitation is felt as anxiety, but that's really part, I think, of the manic episode or the hypomanic episode you might be going through. Okay.
All right. Thank you.
Right, good luck with that, all right?
Thank you.
Okay. While we're waiting, maybe we can tell another little story.
Sure.
I can tell lots of stories. Is there someone calling? Okay. Sometimes what we do is we often do things to reassure ourselves. This one guy was always worried about his health, so he kept checking his pulse. He kept checking his pulse. For what reason? Obviously to see if it was normal. So what are the possibilities when we check our pulse? Well, there's a number of possibilities. One is that he's not there, but he wouldn't be there if it was low, or if his heart would stop. So there's two possibilities. One is that it's normal. The other is that it's high. So if he checks his pulse, he's looking for reassurance. So if he checks his pulse and it's beating faster than it should or than he expects, what's going to happen? He's going to freak out. In other words, he's going to have an immediate panic by checking his pulse. The more you focus on your body, the more you notice these normal variations, and then all of a sudden he's going to say, that's not normal, and that's going to feed his anxiety, which will make his heart go faster, and so on and so forth. So that will create panic. Let's suppose he checks his pulse. The other possibility is what? That it's normal. Okay? Well, that's worse. Why is it worse? Well, because when we check, we feel reassured. What about now? Let's check again. In other words, every time he gets a thought, he's going to have to check. So it's a question of time before he checks, and it's a little higher than normal. And then, now it's not normal. In other words, by checking all the time, he's either going to panic immediately or panic eventually. And so the more we constantly focus on our body, the more we notice normal variations, and we misinterpret those normal variations as a sign of something and makes us freak out. So always looking for the reassurance is not the answer. The best thing to do is to learn to let it pass on its own. Like imagine if you have an MRI machine in your house, and every time you get a headache, you just stick your head in this machine for a few minutes, and okay, it's fine. Well, what's going to happen one day when your machine's not working and you have a headache? Then you're going to freak out. If, on the other hand, you don't do anything, by the next day, your headache's gone, you learn, I guess it was nothing. You learn to tolerate that. Same thing with this gentleman. Every time he thinks he has a heart problem, if he didn't do anything, he would see that he's not dead, and eventually he would learn to stop worrying about his heart. So, checking, focusing on your body only keeps you more and more worried and focused on that. So that's not going to happen.
I had a quick question. When we have our partner, let's say, is feeling anxious, what's the best thing to do?
Look, obviously there's depends on what they're anxious about and so on, but for the most part, when someone's freaking out, it's very hard to reason with them. So usually, like if someone says, "Oh my God, I'm dying, I'm this, I'm that," at the time, try and reassure them. It may help, but for the most part, I would say just try and calm down, relax, look at me, and so on and so forth. And then after they've calmed down, that's when you can reason with them. Sometimes the next day, sometimes teaching them that, look, this is something that has happened before. You're healthy. Let it go. Don't fight your body, and so on and so forth. So when they're in the moment, it's a little hard to reassure them. But generally, the best advice I can give people is, when you're anxious, don't do anything. Don't do it. You don't have to breathe a certain way. You don't have to control your body. You have to just realize there's no danger there. Don't do anything. It'll pass. So let go, stop pushing, and you calm down. Look, I'll tell you this. I've treated people with anxiety for 35 years. I have seen at least hundreds, if not 1,000 patients. Each of them have had hundreds, thousands of panics. Okay? Let's do the math. That means I have seen people who've had over 1 million panics in their lives. And I have never, ever managed to convince someone to panic in the chair in front of me. I try all the time. I say, go ahead and panic. And they can't. The reality is that when we try hardest not to panic, we panic. When we say it doesn't matter if we panic, we can't panic. And that's for a panic disorder. I mean, obviously, people are worried about other things, sometimes thoughts, whatever, but ultimately, you have to show to yourself that it doesn't matter. And when you actually believe it doesn't matter what your thoughts are or what your body does, then you can't be anxious. You can have normal anxiety, but you're not going to be anxious about being anxious anymore. And it sounds crazy, but think about it, right? Think about when people panic. They always panic when they say, I better not panic now. And they can't panic when I tell them not to, when I tell them to. In fact, sometimes in a metro, if someone's worried, I say, okay, try and make your heart rate go faster. I mean, they can't, because you have to first start by stop trying to slow it down, and then you quickly realize that it can't get any worse, and so then you calm down. A person who feels as if they're not going to panic, they feel, okay, I'm not going to panic anymore. Well, they're going to panic. I can guarantee that. A person who says it doesn't matter if I panic will not panic again. And that's the paradox of it. It's a fear of something. It is not the thing itself. And people who are anxious about going crazy, people who are anxious about illness, it remains a thought. Just before I came here today, I spoke to a lady who's a hypochondriac, and she's going through a mammogram, and she's had a sore back for 2 months, and what could it be? And of course, in her head, it's always the C word. That's all she thinks about. And I said, the problem is that you want the guarantee that you have nothing. And you're not going to find a guarantee that you have nothing. What I can teach you to do instead is tolerate not knowing for sure. So I tell my hypochondriacs the following two realities. Reality number one is very reassuring. Reality number two is worrisome. But they're both absolute truths. Absolute truth number one, you are probably going to die an old man or an old lady. That is absolutely true. Absolute truth number 2, and that's reassuring. Absolute truth number 2 is you possibly will die younger. That is also true, and it's not very reassuring. But the reality is that probably you're going to die old, possibly you're going to die young. What that means is that the odds are in our favor, but we're never going to get the guarantee. So the person who's looking for that guarantee, the person who's looking for that certainty that nothing bad is going to happen, is always trapped in the what-ifs. The reality is that I can't get rid of that. Anything is possible, but I have to be able to tolerate that. So rather than saying, I got to do something, I call my kids to make sure they're safe, is no, I need to get used to not knowing. Instead of making sure that I don't have an illness and I got to get to a doctor and so on and check the internet, I have to just learn to say, I have to get used to letting this pass. And, if it's obvious, you're going to go anyway. We all go to the doctor when it's obvious. I mean, if you look in the mirror and there's blood coming out of your eyeballs, you're going to go to the doctor. It's going to be obvious. But when you're worried about what is this, a little ambiguous stuff, you get lost in all of that stuff because you're looking for certainty. And so tolerating uncertainty, tolerating doubt is ultimately the best way to overcome anxiety because, as I said, when you're afraid of something, you need to control it, and that's a good thing. But when you're afraid of things you cannot control, when you want absolute control over things, then you become a slave to that, and the only solution is to learn to tolerate that a little bit. Okay?
Okay, thank you very much.
My pleasure.
My question is I found the doctor very interesting. I was wondering if it's possible to know where he practices.
Well, I have a practice in Montreal, in Old Montreal. I have a website if you want, drzacchia.com. But if you're interested in consulting, there are a number of people in wherever you happen to live, and you can either call the Order of Psychologists for a referral, or you can call me, and I'd be more than happy to, or send me an email. I'd be more than happy to give you some names of people in your area.
Thank you so much.
My pleasure.
Oh, go ahead.
I just have a question. Where can I get the the information online that you were mentioning? That you have.
Yeah, we're gonna. I don't know. You can. Mark can maybe answer the question. I'll give him some links, and he can put it.
Yeah, absolutely. So go on. It'll be up in a week or two. It'll be on our website, AMI-Quebec.org, and we'll also have a SoundCloud channel, which is for our audio podcast. So you'll be able to get it all on our website, AMI-Quebec.org.
Thank you.
You're welcome.
Hello?
Hello.
Yes, I'd like to know, would you say that a lot of problems that we have with mental issues is a lot of it is based on anxiety?
Yeah, well, certainly anxiety is probably the most common mental struggle we have. I mean, it's certainly what I talked about today. What's important to understand is what I talked about today is a pure anxiety disorder. It's a problem with the anxiety mechanism itself, okay? But anxiety is also a symptom of many other conditions. I mean, the gentleman before talked about bipolar disorder. If we're depressed, we're often anxious as well. If we have a psychosis, we could be anxious. If you have interpersonal problems, we're having trouble at work, we're not getting along with people, we're going to be anxious. So anxiety certainly is an emotion that is felt in every mental illness that we can possibly have, okay? On the other hand, sometimes the anxiety itself is the problem. Sometimes we're more afraid of being anxious. So it is when we're anxious of being anxious. Anxiety is an alarm that rings in the face of a threat. If we're threatened by anxiety, then it's like having two alarms that, ring. One rings and then sets off the other one, and then the first one goes back, and so on and so forth. So yeah, it's very common. Obviously, it's part of many disorders. So I'm not sure if there's something more specific you wanted to ask about that, or. Hello?
Yes, I suffer from anxiety, and I'm on medication for for a antipsychotic and antidepressant, and I get anxiety every once in a while. But it's how do you control your thoughts when they get out of control? Do you have a method, or?
Well, okay. I mean, look, obviously we're talking about a mixed bag of problems here if you're taking different medications. And sometimes, when we have unwanted thoughts, I mean, if we actually are out of touch with reality, if we do have a psychosis, then we need medication to control that. And the good news is that the medication is very effective for those kinds of things. But oftentimes we also suffer from anxiety, so we need to take an antidepressant for that. But because there's other clinical issues here, it's harder to feel completely 100%. But ultimately, it's the same thing. You need to not be afraid of your thoughts. I mean, if you have thoughts that are completely out of touch with reality, then you need to talk to your doctor maybe about changing the dose of the antipsychotic medication. But with respect to anxiety, it's really no different. The reality is that it's a fear, it's not reality. And so you need to not care what your thoughts are. You need to not worry about having a thought. It's just a thought. If you start acting on your thoughts, then it's not an anxiety problem. But ultimately, you need to recognize that fear is imagination, anxiety is imagination, and therefore it's like watching a movie. You don't have to do anything about it. It's not as if there really is somebody blowing up on screen or a building coming down. It's just a picture. It's just a prop. And anxiety is kind of like that. Maybe I'll leave you guys with one last image, if you will. There's a painting by the French surrealist René Magritte, who I'm sure you've recognized if you ever saw his paintings, but like a guy in a bowler hat. It's a silhouette thing. And there's another one. It's a painting of a pipe, and underneath the pipe is a caption: "Ceci n'est pas une pipe." This is not a pipe. So it's a painting of a pipe with a statement: "This is not a pipe." And it's simple. It doesn't, it's almost silly, but it's brilliant at the same time, because you can't put tobacco in it and smoke it. It's not a real pipe. It's a representation of a pipe. And that's what anxiety is. Anxiety is a representation of something horrible, and we need to avoid horrible things. But, sometimes we are caught in this inability to separate imagination from reality. We need to avoid real things. We don't need to avoid imagination. So most of the time, anxiety is a fear of something. It's not the thing itself. So the fact that you don't have control over it doesn't matter, because you don't need to control anything. You don't need to control your thoughts. You don't need to control your body. It takes care of itself.
Okay, so I think we're going to wrap up now. It's about 8:15. I wanted to thank Dr. Camillo Zacchia. His website is drzacchia.com. Did you have anything to mention before we wrap up?
No, there is, as I said, there is in my blog a fairly lengthy article I wrote for Phobie Zero and for people who suffer from panic. It's particularly appropriate for panic, but I think it's appropriate as well for all anxieties. And it's in there. It's an April 2009 post, but we'll give you the direct link. And in the blog, there's also a category of anxiety. If you click on anxiety, there's stuff there on intrusive thoughts. There's stuff there on panic. There's stuff there on hypochondriasis. Stories, stuff like that, columns that I've written in the past about it. So there's also some videos that you might find helpful, and yeah. So good luck with that, and I hope you guys manage through all this. All right. It was a pleasure to speak to you all.
Thank you.